My name is Andy Backrow, and I will be today's moderator. Our featured speakers today are Asif Shah Mohammed and Darren Libby. Asif is a principal at ECG and a leader of ECG's digital health practice, who brings his business planning acumen and expertise in both strategy and implementation to help healthcare providers understand the current competitive landscape and improve their technology strategies. He has worked extensively with clients by leading multiple engagements, including business planning and implementation of organizations' digital health initiatives, including telehealth, wellness, and population health management strategies, and go-to-market planning and commercialization of new technology investments. Darren is a principal with ECG and heads the firm's strategy and business advisory division. He has over 2 decades of experience in healthcare strategic and business planning, with a focus in ambulatory services and strategic partnerships. Darren works extensively with health systems, children's hospitals, and physician organizations to pursue a variety of strategic opportunities that are focused on driving revenue and margin growth through expanding and optimizing delivery networks through acquisitions, partnerships, and innovation. He is currently involved in advising clients on the adoption of digital health initiatives to heighten consumer engagement and more proactively manage patients' health needs. ECG's We Believe series is designed to be a provocative call to action for what healthcare organizations must do now to ensure their sustainability in today's environment, and a future wherein we believe the pace of change and industry innovation will require a change from the status quo. Today's webinar focuses on how the digitalization of healthcare has prompted a quantum shift in the traditional physician-patient relationship, driven by the proliferation of technology and consumer demand for convenient, personalized services. The rise of consumerism, where individual consumers will have and expect more responsibility for deciding how they will access and pay for care, has accelerated investments in and focus on innovative care delivery through digital transformation. This shift to a consumer-centric approach is rapidly altering the economics of care. During today's program, ECG's experts will review how leading health systems are establishing cohesive digital health infrastructure that enhances the patient experience, provides seamless communication between patients and their care teams, and generates a favorable ROI. Before we jump into the presentation, I'd like to launch our first polling question. Our first polling question should be appearing on your screen and reads, what is your organization's strategic imperatives priority for driving digital health transformation? Please select all of the responses that apply. Empowering clinical decision-making, enabling operational efficiency and performance improvement, increasing patient access, connecting patients, providers to enhance patient experience, driving consumer engagement, and brand loyalty. Let's see how the responses are coming in here. This is a little teaser to get us interested in the conversation and see how we're doing here. It looks like we've got some pretty good distribution. And with that, why don't we go ahead and wrap this particular poll and let's see what the answers suggest to us. It looks like we have 46% with empowering clinical decision-making, 75% with enabling operational efficiency and performance improvement, 79% with increasing patient access, 89% connecting patients and providers to enhance the patient experience, and just 57% with driving consumer engagement and brand loyalty. So Darren, any thoughts on the results here?
Well, Andy, I think it's indicative of the fact that digital health is the catalyst for transforming the delivery of healthcare. Each of these areas, and looking at the operational efficiency, looking at how you're improving access, are all transformative in the healthcare delivery system. So what we're really looking forward to is walking through today some of the experiences and perspectives that ECG has gained with our clients. So why don't we go ahead and jump into today's content. And I think it's a recognition, certainly from the results of the poll, that organizations are committed to a continuous pursuit of using data and technology to elevate performance. We think it's primarily yielding superior clinical outcomes via better care coordination, advanced diagnostics, and precision medicine. But secondarily, as the results showed, the use of automation and AI to improve operational efficiency and yield better financial margins in an increasingly difficult economic environment for healthcare organizations. But at ECG, we think that there's also this opportunity to ultimately drive heightened consumer engagement that will provide top-line growth for organizations. And we'll get into that in more detail throughout today's webinar. And this pursuit does require thoughtful planning and discipline to focus investments on the acquisition of infrastructure, as well as training and recruiting talent necessary to successfully implement and adopt these initiatives. So as I said, we're hoping to share our perspectives, working with some of the leading healthcare provider organizations on developing a comprehensive and cohesive digital health plan. This comprehensive approach should focus on how you use data, both patient data, to engage consumers and deliver better care, but also operational data to drive improvements across different organizational areas. With much of the recent public coverage on digital health, it's really focused on virtual visits, wearables, and health apps. And while these are all important uses, ECG does believe it's critical for health systems to fully gain their strategic advantage to take a broader view on defining plans that capitalize on the full potential of the digitization of healthcare delivery. This digital-first strategy must view data as a strategic asset, and health systems must leverage the existing capabilities you have, such as your investments in electronic health records and CRMs to capture more data, but also to establish new capabilities if you don't have those related to requires the traditional protected physician-patient relationship. But the change of the consumer being more comfortable sharing information and the improvements in data security are creating market demand that we believe will continue to rise. And we encourage healthcare leaders to look outside of their industries to learn on how others are adopting technology and using data to drive heightened business performance. And you can take your pick on the industry, whether it's home automation, retail, travel, autos, banking, all are using data to strengthen consumers' loyalty with a goal of both growing revenue, but also using technology to redesign and develop better products and services at a more competitive price offering. We've looked at a number of industries, and the banking industry is one that we would encourage organizations to take a closer look at. We know that personal finances are one of the most protected aspects of our lives, yet banks have created our ability to make transactions, apply for loans, redirect investments, check balances, pay bills, etc., all electronically and all via smartphones. And we view that technology is the accelerant of change, and with COVID, and it has really changed our lives forever, and we know that the future will be different than the past. And so at this point, what we'd like to do is open up our second polling question, which should be relatively quick.
Our second polling question should be appearing on your screen and reads, is your organization considering increased investments in digital health given the COVID-19 pandemic? Please select yes or no. We have a lot of 100% looks like coming in on yes at this point. Get 54% of our vote in. I think this is a question we hear being discussed in the C-suite in almost every interaction we have with our clients. It's what's our digital health strategy and how are we planning to move forward in response to the pandemic. And in fact, most of our clients would tell us that they're accelerating their digital health strategies, and it seems like this poll is actually validating that. So I think we can safely close this poll with 100% of the respondents indicating yes. Darren, are you surprised by these results?
I'm surprised that it's 100%, but I'm certainly excited about the amount of the commitment that our participants have, and very probably telling on why they've carved out a portion of your time to listen today. We can reflect on before COVID, we had a number of organizations that were developing strategic plans, and most of these plans were aspirational, but adoption was relatively slow. And with the pandemic, we've recognized that it's placed unprecedented strain on the system, and we're seeing that the plans are being accelerated. Few of our clients had plans that had implementation timelines of over a year that were compressed into a matter of 2 to 3 weeks. And it's, I think, a testament to the amount of dedication and investment that health systems have on keeping their staff and patients safe in this time. So why don't we jump back to the presentation and continue to really think about the patient engagement in this consumer-centric model as an opportunity for organizations to realize some of the economic return from their investments in digital health. And we know that this transition to a consumer-centric model will require, increasing investments to adopt, an array of software applications with a key objective to exchange information, connecting the patient to their organization on multiple levels. During COVID, we've recognized the valuable benefits of virtual visits and chatbots and messaging, offering timely access while maintaining safe environments, but also digital solutions that have demonstrated the importance of educating patients by pushing information via online venues and real-time communication to communities. And once patients do present to a clinic or hospital, the applications allowing you to elevate the service levels, offering education and wayfinding and triage, and it creates a safer environment for patients and staff. When we look at this patient-centric model, we do believe that healthcare organizations have a key strategic advantage given the physical assets, both facilities and talent, that being providers, that you have in your organizations. And while this market is changing rapidly, that health systems do have, we think, an opportunity to leverage their existing physical assets and capitalize on implementing digital health solutions now. With the new competitors seeking to transform delivery of care, healthcare providers can't simply avoid this disruption, and consumers have increased their purchasing power, and the impact is transforming really the way that employer benefits are designed, putting economic decision-making in the hands of plan members and participants. And increasingly, apps are recognizing that this health information in the hands of the consumer is an opportunity from a business standpoint to enter the healthcare field and identify margin opportunities. And certainly well-capitalized non-traditional organizations like Amazon, Google, and Walmart, are all recognizing the fragmentation that exists in our industry and beginning to identify ways that they can deliver healthcare and share information, whether it's through virtual connections or ultimately investing in ways to provide care in physical settings to capitalize on more of the traditional healthcare services. The opportunity from an economic standpoint, when we look at what's at risk for health systems, we recognize that the investment that's made is both an offensive and a defensive play, that the economic consequences of not investing in a digital strategy are fragmented care, which is not the same outcome you want in terms of coordinated care, but also a loss of downstream revenue. ECG, we recently conducted an assessment for a large health system to estimate what is the revenue associated with an attributed patient to their primary care base. And under some conservative models, it represented $18,000 in net revenue over a 5-year period. So the consequences of not retaining consumers and allowing them to, or seeing them migrate to other care providers or other sources of health services, puts material risk on the top line revenue of health systems in an increasingly difficult economic market. but it also creates an opportunity for organizations to capture more revenue. In this viewpoint, that having the physical bricks and mortar along with the digital health aspects that health systems have, we believe creates a clear market advantage for those that are willing to invest in digital health compared to niche providers that really seek narrowly defined roles or businesses in the industry. But to gain this strategic advantage, it really requires that consumer-centric model that organizations create a robust digital health ecosystem that scales that personalized experience across broad spectrum of services. Now I'm going to hand it over to Asif, who will share his perspective on how to create that digital health ecosystem.
Thank you, Darren. Now that we've discussed some of the key imperatives and economic drivers for pursuing digital transformation, on this next part of our discussion, let's spend a few minutes on the technology enablers, critical success factors, and building blocks to creating the desired future state via comprehensive digital health transformation strategy. As Darren discussed earlier, an effective shift towards building a digital health enterprise requires a commitment to managing data as a strategic asset. Health systems have to integrate data from multiple sources, including their core EHRs, their clinical applications, including ancillary systems, non-clinical, financial, and operational platforms, third-party provider data, wearables, social determinants of health, payer data, so on and so forth. So this data, all of this data needs to be integrated on secure and easily accessible data platforms. Reliable and secure data together with advanced modeling and AI will then empower data-driven decisions within the health systems, both the clinical and operational decisions, or even directly help consumers to make the right decision in their care. Ultimately, the goal is a cultural shift to a digital-first mindset powered by the right technology enablers to create a continuously improving learning health system. So the learning health system that we're envisioning has a few key characteristics and building blocks. The first characteristic is collaboration and communication. This includes the technologies for patients and clinicians and care teams to engage with one another. Second, developing awareness and intelligence. The system will need to be highly instrumented and sophisticated capabilities, including data integration and connectivity with the Internet of Things, for example. Ability to continuously monitor the patient experience through analyzing situational awareness and patient data events to yield operational intelligence. Third characteristic is leveraging powerful analytical tools, including AI technologies and predictive modeling, to track health systems' performance, balance resources, optimize staffing, and manage patient throughput to empower operational decision-making. And finally, the use of adaptive technologies, including APIs, for example, to continuously learn and evolve with the experience and changing circumstances. As such, this learning health system vision is the model of a health system that can see and act in real time to improve care outcomes, patient engagement, and administrative processes. Leveraging existing and up-to-date information and combining it with communications technology in a manner that significantly improves the patient experience, transforms the delivery of care, and is designed around the specific needs of the consumer. This is the case whether they are your routine administrative touchpoints that typically frustrate patients or the disjointed care delivery workflows that may reduce operational efficiency. Let's talk next about how a comprehensive digital health strategy spans the care continuum. The rapid adoption and expansion of telehealth visits during the COVID-19 pandemic has become a catalyst to implement more comprehensive digital health plans that integrate technologies and share data across the care continuum. There is no argument among industry leaders that integrated, coordinated care is better. However, health systems have struggled to make this a reality given the fragmentation of providers in our healthcare system. Now, the convergence of an array of technologies is resulting in accelerated advances in the prevention, detection, treatment, and recovery of patients. This requires going beyond our transactional encounters and integrating data and applications across care settings, ambulatory, acute, and post-acute, to exchange real-time data among providers. The overall intent is to provide the right data, the right care, at the right time, at the right setting. For example, in the acute setting, investments in clinical decision support and precision medicine will improve outcomes, but the degree of effectiveness will rely on the organization's abilities to capture, store, and analyze that data to then share information across care with providers. Ultimately, the integration of technology with care delivery will enhance, not replace, our traditional settings. Delivering this seamless consumer-patient experience will require health systems to facilitate extensive interactions with patients, using data and continuous insights, expand care beyond our traditional brick-and-mortar settings, and drive engagement by offering convenient access via online presence and using post-acute and home-based services that are then linked back to the care continuum. As we move towards this consumer-centric model, a digital-first approach will use consumer and clinical data to engage, activate, and navigate patients through highly personalized health activities that align with the optimal health pathway for individual patients. One of the domains that we are seeing increased focus on is the concept of the digital front door. Much of the front doors of a hospital or outpatient clinics are used as the primary access points for face-to-face consumers. The digital front door is the means of digital interaction with consumers and patients. Let's dive into this a little bit more. We define the digital front door as the means to digitally engage patients at major touch points of the patient journey, and it leverages multiple technologies to increase patient access, drive higher patient satisfaction, and increase revenues. So this comprises of a omni-channel communications approach with multiple platforms, including web portals, mobile applications, chatbots, SMS, and voice, to provide multiple stakeholder groups, i.e. patients, family members, or provider partner organizations, centralized access to a health system's digital and analog products and services. Earlier, Darren referred to the non-traditional competitors to health systems. Already, we are starting to see these non-traditional players developing alternatives to primary care access. For example, CVS Health, a partnership with CVS and Aetna, has launched a series of health hubs in their walk-in clinics, which it refers to as the new front doors for healthcare. Patient navigators steer healthcare consumers to a menu of available services, including in-person consultations with primary care physicians in store. While this may not sound like a digital front door at first, consider this. Having access to the combined patient health records of CVS and Aetna means that be mined and analyzed to identify care gaps, allowing caregivers to proactively reach out and schedule services such as routine visits, whether done virtually or in person, prescription refills, or periodic tests. We believe that despite emerging non-traditional disruptors, health systems and provider organizations have the advantage of the personal bonds between the patients and the trusted physicians in their own communities, which cannot be easily replaced. Therefore, health systems have an opportunity to design the digital front door that starts to engage the patient or consumer at the earliest stages of their health journeys and acts as the conduit connect consumers with healthcare products, services, and information that help them achieve their health goals. In our view, a key design principle for the digital front door is that it should allow for using the consumer's preferred channel of communications. This will provide the ability to attract, engage, and build a trusted relationship with the consumers and patients, and offer stakeholders convenience, ease of use, and increase adoption. So let's take a look at what the digital health ecosystem infrastructure could look like. To offer patients or consumers interactions, health systems will need to conduct strategic technology and operational planning that will establish robust backend platforms. We start with 5 core foundational capabilities that will need to be in place. These include data storage platforms, analytical tools, interoperability capabilities, patient interface tools, and CRM tools. Building on these foundational capabilities, the backend applications will serve as the source of all clinical and non-clinical data across the entire care continuum. To facilitate this infrastructure, clinical tools such as EHRs will evolve from documentation tools to smart solutions that allow clinicians to more direct interaction and help facilitate the practice of evidence-based medicine. Additionally, organizations will increasingly turn to digital health tools, including AI, to enhance front and back-end workflows, deploy automation, and drive operational efficiency. The patient-facing, i.e. consumer engagement tools, will then need to integrate seamlessly with the back-end platforms in the digital health ecosystem. We anticipate that recent regulatory changes such as ONC and CMS's final rules for interoperability and information blocking provisions in the 21st Century Cures Act provide the regulatory framework and the incentives to accelerate the ability for providers, payers, and technology vendors to provide patients safe and secure access to their digital health and better integration with all of the back-end platforms and the front-end consumer engagement tools. In addition to supporting these capabilities, it is important that robust cybersecurity should be in place, and its effectiveness against vulnerabilities and potential for data breaches tested by unaffiliated third parties. In the next slide, we want to highlight a case study from an organization that has taken this consumer-centric approach and developed a comprehensive digital health strategy that aligns their overarching enterprise vision. Cone Health, based in Greensboro, North Carolina, had about 5 years ago to develop a coordinated approach for its telehealth initiatives. Although the strategic imperatives for developing this initiative appear to have been driven at the time by a need to react to competition and patient access related concerns, improved quality of care and population health management were also very important to the organization. Therefore, they envisioned that a robust telemedicine program would include a variety of solutions in the longer term that would be delivered by several provider types across the organization and serve the larger population in the community. The organization's initial entry into a robust telemedicine program seek to address immediate concerns and establish a position in the marketplace. Based on technical readiness and immediate organizational and patient imperatives, the most compelling point of entry for Cone Health was ascertained to be asynchronous e-visits, followed by real-time video visits, which included both on-demand and scheduled visits for primary care and specialty consults. With a robust governance model in place, the organization has been able to build on its foundational infrastructure over time and accelerate the development of an overall consumer-centric digital front door by segmenting their patient populations, for example, with specific chronic conditions, diabetes, CHF, COPD, etc. It has scaled remote interactions with home-based diagnostics and equipment. By continuously demonstrating the value of virtual care and quantifying clinical outcomes, access improvement, and patient-provider satisfaction, it has been able to drive advocacy for expanded coverage. Cone Health is now very well positioned to enter into contracting, for example, with insurance payers for risk models to manage overall cost of care. Let's launch our final polling question. Andy.
The final polling question reads, what are the barriers to adoption of digital health transformation for your organization? Please select all that apply. Funding and investment challenges, executive leadership buy-in, payer reimbursement considerations, internal staffing constraints, demonstrating ROI. This is a really good question because one of the primary topics we have with clients around digital health is where do we begin? And so I think there's somewhat of a reluctance to really go deep into the digital health applications, partly because it's just such a big topic for organizations. And sometimes organizations anticipate barriers, but they might not actually be there. So it'll be interesting to see how these results from our webcast participants weigh in on these various options that are out there. So we are at about 38% voted. Why don't we go ahead and close this poll and we'll see what these answers show. So we have 76% citing funding and investment challenges as barriers, 24% executive leadership buy-in. Hopefully that means there's C-suite champions for this. 48% indicating payer reimbursement considerations, 44% as internal staffing constraints, and 68% citing how do we demonstrate the ROI on this. So, Darren, any thoughts on these results?
Yeah, I'm not surprised in terms of the financial elements really scoring higher as being barriers. We recognize, and I think that was showcased in the first We Believe webinar, that the economic challenges that healthcare organizations are facing, the investment in many of the digital health technologies and applications has a longer time horizon around investment return. But we think that there are some ways that organizations are thinking about the economic advantages and strategic advantages of their digital health strategies that help to provide a more favorable return on investment. So as we go through this next section, hopefully we can share some insights that will help you frame the conversation that begins to develop plans that really overcome some of the financial challenges in investing and implementing in the digital health plans that you seek to embark upon. When we look at the opportunities, if we go to the next slide, there's really two strategic ambitions. One is increasing the consumer base or revenue base of the organization. The other is around organizational transformation. Along these two different strategic ambitions, your organization may be at a different point around where the investments need to occur. So this is not a sequential buildup that you do, engage the consumer and then move to improved operations. But really thinking about first top line revenue growth, that the expectation with any digital health plan should be that you are capturing more revenue by increasing your reach to patients and minimizing some traditional barriers presented by geography or patient mobility. And this creates opportunities to rethink your traditional geographic service areas. For example, telehealth visits, enabling specialty care in rural locations, or we have clients, pediatric subspecialists, that are offering consults to patients that otherwise would have to travel long distances to access the expertise of those leading institutions and clinicians. Both examples, providing, access improvements around improved revenue, and then better utilizing valuable physician time that creates ideally higher margins in the organization. We know that the demand for various services, we're having clients think about, are there new service offerings, including the subscription type models that I'll talk about in just a moment. The next area on organizational transformation is about, can you reduce the total cost of care, and knowing that that has some longer term implications. It certainly, I think, has the ability to create a stronger bond with patients, but using that data ultimately to drive organizational transformation that improves decision-making, both clinical and operational, that allows you to operate in a more competitive cost environment. Examples include the use of automation in back office revenue cycle functions. We know that organizations are yielding a more efficient and effective billing process, and doing so requiring less labor. That is a longer term investment, but certainly taking the time horizon to evaluate those investments and the return that they will provide is an important part of developing plans. We know that the design and implementation of the digital health applications and infrastructure, is an important decision and really requires a very careful evaluation of some of the economic implications. But when you begin to pursue really the plan, we think about it from a discipline standpoint of how do you look at the economic implications of each of the potential investments that you need to make, but doing so in the context of this broader comprehensive digital health ecosystem that Asif referred to. Try to avoid chasing the next shiny object or the latest technology or app, and instead develop a plan that prioritizes and sequences the pursuit of your specific elements based on your organization's market and the level of impact and economic return that will have, whether it's enhancing revenue or reducing operating expenses. And as I mentioned, organizations are increasingly looking at the subscription type plans that link the consumer-centric strategy that we discussed with new economic models. And these plans give the members access to different levels of prepaid care or the use of digital health applications to elevate their interactions, creating a stronger bond with the provider organization. Members will typically be encouraged to subscribe to digital access to their physicians and various healthcare services that are offered. In pricing, from our standpoint, we've seen it range from free offerings with relatively limited access to start to engage that consumer, to programs that are upwards of $100 per month with a subscription that offer a premium service with access and consults to specialists and at times concierge type services for those subscription fees. And we know in general that the consumers are willing to invest in this approach to ensure access and convenience, and that they are more comfortable with this type of care model due to COVID and the impact that it's had on all of our lives, but also their familiarity with other subscription models in other industries. The fact that people will pay $15 a month on Strava to get data is reflective of why wouldn't they spend that to capture health information. Now, the consumer demand is for convenient low acuity services is a growing area, but from our standpoint, it won't yield a sufficient return to really capture the investment of the comprehensive digital health platform. Rather, successful adoption is going to require health systems to transition to new payment models and to align this economic shift resulting from digital health to their payment models to ensure a favorable return on the investment of technology. And the exact strategy will depend on your specific market, whether it's a high percentage of fee for service or areas where you can leverage the consumer-oriented subscription plans, but also thinking about digital health resulting in a reduction of utilization of services and starting to embrace payment models that look to share savings or offer risk associated with the total cost of care. So in particular, health systems should move more aggressively into advanced payment models as they are adopting and implementing their digital health systems. Now, given the high investment in both terms of capital acquisition and talent, more organizations are pursuing partnerships and alliances to share the cost and leverage scale. And so I'd like to have Asif maybe talk about some recent client examples that are doing such.
Yeah, thanks, Darren. So healthcare's digital transformation is critically dependent on strategic partnerships with technology vendors, augmenting existing relationships with payers, pursuing new alliances and alignment strategies with other healthcare provider organizations, and finally, developing cross-industry partnerships. No single vendor can likely meet all of the needs of digital transformation. Therefore, health systems will need to develop strategic partnerships that allow them to achieve scale and enhance capabilities using a structured evaluation of business models and core attributes and alignment with the organization's overall strategic imperatives. Let's discuss one of these partnerships. Kaiser Permanente has set an example of how a large health system can thrive in a capitated payment environment through leveraging digital health solutions. Even before COVID-19, Kaiser had reported that over 52% of its more than 100 million annual encounters took place virtually. The organization has steadily been increasing the number of channels available for consumers to access care, including text messaging, chatbots, video, phone, email, and other mobile applications, and was therefore very well positioned at the height of COVID-19. Kaiser, like other health systems in the US, has understood the need for increased focus on social determinants of health. To address this, Kaiser recently launched Thrive Local, a social health network aimed at connecting health and social services to better coordinate and improve patient care. This partnership is part of Kaiser's mission to treat total health by accounting for patients' social and community needs. In this partnership, they are utilizing a software platform that also tracks outcomes and helps community care partners collaborate with providers on care. This program will be integrated into Kaiser's EHR systems and allow providers to connect patients to a variety of community resources for social needs such as food or housing insecurity. This investment is only one component of a multi-year strategy to bridge the gap between traditional healthcare organizations and the community and utilizing data to truly transform care delivery. How a learning health system can allow organizations to access insights that drive personalized care. So throughout this presentation, we have talked about the need for a consumer-centric approach. Few health systems can say that they own that consumer relationship in the sense that leading service organizations think of their relationships with their customer base. Why does this matter? Because we believe that much of the future of healthcare is digital, not just deploying digital front door capabilities that we discussed earlier. This merely solves the access and convenience problem. Health systems will then need to integrate these assets with their EHRs and unlock the rich data that's available in these platforms. Then mine that data with robust analytics and AI-enabled health management and precision medicine in care delivery to utilize this information proactively as an engagement tool. This is the inherent advantage that health systems have over new market entrants and non-traditional disruptors. This will then unlock the potential to connect with larger segments of the population or even expand beyond the brick and mortar business and other traditional boundaries. In our view, this will allow digital health to become an enabler of the vision to create systemness, access to the insights to drive personalized care, delightful patient experience, and lasting brand loyalty, and one that will allow organizations to manage information or data as a strategic asset. Let's talk a little bit about some practical steps towards becoming a learning health system and using data as a strategic asset. So, data alone is not the solution. Gains are only realized through integrating core systems, operationalizing digital health solutions, and creating a learning organization. As a first step, organizations need to view data as a strategic asset and then manage the collection and storage of that data. Due to the vast amounts of data that's being captured, organizations then must establish advanced analytics and AI to convert that data into meaningful information, insights that will inform clinicians, guide patients, and enhance operational processes. The next advancement occurs upon sharing knowledge to collaborate and capitalize on the expertise of various stakeholders. We believe that organizations that establish integrated, informed care teams will realize more significant gains in health outcomes and improved operations. The true learning organization requires a culture that embraces the pursuit of innovation and excellence with a willingness to create, adopt, modify. Let's talk a little bit about some of the key success factors to implement a digital health strategy. The pandemic has demonstrated that there is definitely appetite for years when some of your legacy regulations and restrictions are reduced or eliminated. This is evident from the way that hospitals were able to create new ways to protect patients and their employees, and providers set out to devise new ways to deliver care. We saw how rapidly organizations scaled their telehealth programs. Novel uses for virtual care have evolved, such as virtual rounding, emergency room, video handoffs, etc. As we saw earlier, and consistent survey that ECG did with health system clients, greater than 60% of respondents indicated increased investments in digital health tools and developing approaches, understanding the importance of data in the decision-making process. There is greater appreciation of the parity of virtual visits versus in-person visits, and patients, providers, insurance companies alike see value in the use of digital solutions. But this is not guaranteed for all organizations. One of the key imperatives to solve for is how do we make this sticky on a go-forward basis? To realize the full potential of digital health's role in an organization's future business plan and strategy, we advise our clients to first develop their future state vision. What is their strategic imperatives? What is it that they're actually trying to solve for? Then ensure that they have established a governance model to provide oversight for this initiative. In our view, the technology is theoretically the easiest part of the problem. Health systems that are contemplating robust digital health programs will then need to develop a decision framework to make key or operational and programmatic decisions about digital health. Finally, they'll need to look across a few key dimensions. First, identify or prioritize the clinical service lines that will be delivered through digital health, including primary and specialty care use cases. Then identify those target patient groups that will be offered those services. Then develop the optimal technology approach, build versus buy, that aligns with the prioritized service lines and populations. The next step is the people aspect, addressing the resource model that aligns the provider availability and capacity with patient demand for services delivered digitally. For each service line that's identified, the optimal locations for the patient to access services from will need to be considered. And finally, no money, no mission. The overall reimbursement model for each service line and a methodology to measure value, i.e. those key performance indicators. So in conclusion, hopefully our takeaway here is that while digital has become the price of entry into healthcare's future state and a powerful tool for differentiation in the healthcare experience of the future, digital itself is not a strategy, but rather an enabler of an overall strategy and a tool to unlock value. True sustainable digital transformation will have to go beyond adopting new tools and technologies. It will require a culture change and reorientation around data-driven models that can create or include a combination of approaches depending on the overarching strategic goals of the health system. With that, I'll turn over to Andy. Thank you.
Thank you, Asif. You and Darren have covered a lot of material in our conversation, and we've had a few questions that have come in. We're probably not going to be able to get to all of these, so we will promise our participants that we'll prepare some written responses and get these back out to everyone. The first question that I have for you is from a participant who asked this question. Digital health seems like a big lift for many organizations, and that train may have left the station, so to speak, for most providers. how realistic is it for many health systems to develop a digital health capability on their own? Or do they need to partner with other organizations, either other health systems or third-party organizations? Darren, you want to take that one first?
Yes, Andy, I'll take that. I mean, I think that's a great question that we would encourage organizations to think about strategic partnerships or alliances to accelerate their ability to acquire the digital health, not only the technology, but also the talent to implement those technologies. So we found, I think, an increasing level of openness around more creative partnerships, not your traditional M&A activity, but thinking about alliances that leverage both the investment in the capability as well as the ability to more effectively implement and operate in an environment where you have digital applications and solutions in play. And then we certainly have seen alliances form around innovation in both the provider sector as well as the investor sector around how do you incubate and develop new ideas in partnership with more organizations that bring a different set of capabilities and competencies.
Okay, great. I think we're going to have time for just one more question. Asif, let me throw this question to you. Digital health clearly has many elements. As advisors to health systems, which elements of a digital health strategy will typically yield the greatest benefit for providers?
Yeah, that's a great question. So with COVID-19 and the presidential health emergency rules, the majority of ECG clients have put in some type of telehealth infrastructure. And as we saw, almost everybody is thinking about digital health. These are resulting from the federal relaxation of our legacy regulatory and reimbursement constraints. However, what we're seeing now is that clients who hurriedly implemented something to meet the immediate needs and provide access to patients are focusing on longer-term objectives to ensure that operational workflows are aligned to successfully achieve their goals, and that they're going to be able to appropriately bill and collect revenue from these initiatives. So our health system clients who implemented telehealth or other chatbots or other digital health solutions during the pandemic are looking for opportunities in 5 or 6 core areas. First is optimizing those platforms that were implemented to address those near-term needs, and then integrating those solutions into the organization's IT infrastructure, i.e. EHRs and clinical and operational platforms. Then rationalizing operations, so having the right mix of staffing and related staffing ratios, workflow integration, etc., to support virtual and in-person visits seamlessly and at scale. Then there's the security and privacy related considerations. And then there's the need to address disparities in access to telemedicine or other digital technologies and appropriately bridging this healthcare equity gap. And of course, there's the reimbursement consideration. So there's opportunities for negotiating optimal payer contracts, as well as developing those risk-based arrangements to incentivize cost avoidance and increase access to care using lower cost delivery mechanism. So alleviating these challenges will help to sustain and grow digital health adoption, both for patients and providers. Our perspective is that health systems will need to develop overarching digital health strategies to meet their changing consumer preferences, and telehealth and other digital front door capabilities that we discussed earlier will need to be part of the new digital health capabilities necessary to become this real-time learning health system, providing the right insights at the right time to patients and allowing for prioritized and timely provider interventions. So if we take this consumer-centric view, the key building blocks for a learning health system are the tools that will facilitate collaboration and communication between the patients and their care teams that allow for awareness and intelligence. And this is where we believe organizations need to start focusing their efforts. So as you build that infrastructure to aggregate and analyze the data from multiple disparate sources, both your back-end applications and the front-end consumer engagement tools, this is how digital health will become this enabler of a vision to create systemness. So one of the things that we want to emphasize is that in developing this consumer-centric digital health strategy, rather than looking at a specific technology and how to deploy it, health systems should think about or think through how it wants its given experience to be for its patient and care teams, and how that technology can enable that experience.
Thank you, Asif. We had one other question come in. We're not going to have time to answer it, but I love the question. And I want to make sure that we get back to our respondents to address it's really a kind of a combination of questions, but one is, what's the role of clinical leadership? And then where does executive responsibility for digital health lie within or reside within an organization? So we'll respond to that in writing. And unfortunately, that's all the time we have for Q&A. And we would like to thank everyone. This concludes our formal program. And if you do have any additional questions or comments, please don't hesitate to reach out to one of us via the contact information provided on the handouts. And one final reminder, we'd greatly appreciate it if you would take a moment to complete the electronic survey upon exiting today's program. As stated earlier, ECG will make a $5 donation to Doctors Without Borders for each survey submitted. Thank you, everyone, and have a good day.